A very good evening, ladies and gentlemen. Thank you for joining us on this perhaps last for this year episode of Cancer and I. And we've had a long year of Cancer and I, and it's been quite exciting. This the kind of years that we've continued to go live with this program on a very, very regular basis. We started this during the pandemic, and we've had multiple experts and colleagues who have been sharing with us important insights into cancer, to the different types of cancer, how to treat them, how to detect them, and most importantly, how do we actually resolve the issue of these cancers over the long run. So as we round up the year, we think it is really only appropriate if we come to you and speak about a very interesting topic which is related to cancer, but perhaps a little different because we're talking about reducing the risks for someone like you and me to actually pick up cancers. And that's what this wrap-up session for 2021 in terms of Cancer and I is going to be about. It's called Looking Back and Moving Forward. And some especially interesting things this evening is the fact that this will be, we will have no special guest tonight. So I am the special guest, I suppose. And it's to share with you a very different perspective of cancer. Now, when we talk about cancer, like when we do with other non-communicable diseases, the things that we're concerned about is usually early detection and screening, and these are kind of very important concepts, very important things that we want to do within the cancer kind of continuum or the whole landscape of cancer. But we also, it makes a difference when you screen frequently for the cancer. Yeah, because if you detect your cancer early, you can actually have a very good clinical outcome. Similarly, we talk about treatment, access to treatment, survival. Today, we are pushing the clock, or if you can, or actually looking back into a much more equally important segment of cancer, which is prevention. Prevention is a very, very important part of any kind of disease. We always listen or hear to this term which says prevention is better than cure. And this is very much true of cancer, more so than anything else. But we know as well that it's very difficult in cancer to really tell you when something is going to actually help you from prevent you from getting cancer, or when something is actually going to be driving you to actually cause you to get cancer. So as we kind of look back, we're looking back at prevention and how to prevent cancer, and some of the research and very clear evidence on where things are in terms of cancer. And what we also want to look at is moving forward into 2022. We've got less than, I think, about slightly a bit over 2 weeks to go to the beginning of the new year. So it is a good time, as it is always, as we restart the new year, to maybe look at things that you can do to kind of reduce your risk of getting cancer. And that's what this session is about tonight. Risk reduction. So at the very first instance, I think it is always kind of good to understand that, and many people ask me and other clinical colleagues this: how can I ever stop myself from getting cancer? Like everything else in life, it is impossible to have a 0% risk of getting cancer. The only people who are at no risk of getting cancer are actually people who are not alive anymore. Anyone who's alive, whatever their age may be, is at risk of getting cancer. Now, as we kind of walk into the rest of our either adolescent or adult lives, every day we have a risk of getting cancer, because cancer is a single cell mutation, can occur to anybody at any time. Now, if that is the case, why even bother? How can we reduce or prevent totally or stop our chances of getting cancer? We can't stop entirely our chances of getting cancer, but what we can do is to reduce the risk. As they would say in kind of the game world, load the dice, reduce the risk. And what do I mean by reducing the risk? Now, all of us are at risk of getting cancer, but we all have different levels of percentages of risk. And what we can do is actually lower that risk. I always share this analogy of is it safe to cross a road? It might be safe to cross a road in the middle of the night, but even then, you're not assured 100% they will be safe crossing that road, because at that time, just one car passing by, even at maybe 2 or 3 a.m., and unfortunately, if the driver is intoxicated, can actually crash into you and hence causing you to maybe even die. So even in the middle of the night, at 2 a.m., 3 a.m., there's never 100% assurance that you're safe when you're crossing over across an empty road. Similarly, okay, on an extremely busy highway, could you run across without actually getting hit? Yes, you can. The chances of that are really very, 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 very low. However, it's never 100%. Similarly, as I was mentioning, all of us have a risk of getting cancer, but by changing this risk, by lowering this risk, we have a possibility of reducing quite significantly your chances of picking up the cancer. And the first question I think that you need to ask yourself, and this is a good time to ask yourself that, is what is your risk for cancer? Now, one of the things that we've put together working with colleagues across different institutions like and world-renowned institutions like the World Cancer Research Fund, is to put together a kind of assessment tool for cancer in terms of your risk to get that disease. And right off, if you're looking at the screen, feel free to kind of scan that QR code, or even we've put down a bit.ly link down there where you can actually look at running this kind of assessment onto yourselves and seeing really what is your risk for cancer. I'm going to give you a few seconds to kind of either take a screenshot or either snap this with your phone, or put a screenshot onto your screen if you're watching this from a screen, or just save this to be kind of used later. What does happen onto this tool is that it is it takes about 10 or 12 minutes for you to actually run. It's a series of questions, and it kind of ascertains what is your risk of actually picking up a cancer. And look, admittedly, there are different things that may cause different people to actually have a risk of cancer. And that's what we try to assess from this tool. Now, what will happen when you get the results? What do the results of this tool, when you actually use them, what are they actually going to mean? This very interesting set of results, which are not comparable to anyone except yourselves, will tell you where you are on a risk scale of whether you're approaching high risk, and it's an inverse scale in the sense that if you are at high risk, you'll score much lower, and as you score better and better, you're actually improving your risk. Now, as I said, and this is something that Malaysians especially get quite tensed about. We always want to score A. So I always have people asking me, what's a good score? What's a bad score? Now, the good thing with this is your own personal score. And while nothing in this world, including risk calculators, are 100%, what we do know is this helps you kind of gauge your own risk in terms of all these different risk factors for cancer. And what you can do is, once you have this first time that you've done this, you'll have a baseline score. That baseline score is actually what you need and what you take to yourself to kind of further reduce the risks in your daily life. Okay, so for example, if you have a score which could be leaning towards high risk, it is time to take a look back. Okay, reassess what are those risk factors that are actually causing you to actually have these different high risk, different risk factors which are causing you to have a high risk for cancer, and subsequently look at modifying them, because there are many modifiable risks that can be reduced. And these risks are the risks that you need to actually reduce. And when you reduce this, you actually reduce your overall risk of getting cancer. So the next question that you really want to ask yourselves is, how can you modify your risk? And this is also a significantly important question, which everyone wants to know, because how basically this translates into something very similar to, how can I prevent cancer? By modifying your risk. And how do I do that? You do that with risks that can be modified. So certain risk factors, okay, are risk factors which cannot be changed. These are non-modifiable risks. These risks include things like age. So no matter how young you look, how much of cosmetic treatment you go for, the sad reality is there is something called age, and that is biological age. And while even that now we're looking at very interesting findings, like how good physical activity actually helps to reduce or impact very positively your biological age. Age remains one of the big risk factors for cancer, because as your system kind of slows down, it's not as reactive as before. It seems to be, and this is for adults, yeah, it seems to be that you have a higher incidence of cancer. So how do you translate that? Age is not something that you can change, as despite all the kind of cosmetic changes that you can do. And this is where it's maybe kind of important to make this statement, where if you have a non-modifiable risk, then it's time to look at aggressively modifying the modifiable risks. Okay, and that's where this is. Another kind of risk, of course, is gender. And again, there's been a lot of discussion about genders, but suffice it for me to say that within cancers, we're talking about chromosomal risk for cancers, and this is largely dependent on what your chromosomes are. And based on your chromosomal kind of factors, gender is then really a non-modifiable risk. Okay, and certain cancers are inherent within only men, for example. And a classic example of this is prostate cancer. It's impossible for a woman to get prostate cancer. But at the same time, there are certain types of cancers which are more inherent in women, but they're not unheard of in men, for example. And breast cancer is really one of that classic examples, where despite about 95% of all people having breast cancer being women, about 5% are actually male. Family history, and this now becomes more and more important as we start to delve into the world of genomics more and more. Now, we're looking at things like genetic factors, blood relationships, and we're finding out, for example, things like breast cancer, which used to be a very, it still is a very strong risk factor of a blood relative having breast cancer. But now we know that breast cancer is linked to a BRCA gene, a gene called BRCA1 or BRCA2, and these genes also help to identify a high risk group, which are males for prostate cancer, for example, and a couple of other cancers as well. But now it's no longer kind of easy to determine that, oh, I have no family history of cancer because I have no close blood relative who has not who is not having cancer or having cancer. So in this now is being negated by the fact that a lot more people are discovering new genetic markers. So which actually are showing us that you're predisposed to a certain kind of cancer. So this is an evolving science, and more and more we're seeing that there is a genetic link between the idea of increasing your risk for cancers. Because let us also be very clear, okay, it's not necessarily true that having a strong genetic link will cause you to have cancer 100%. It's not. It's an increase of risk, and in some cases a significantly increased risk. However, it's never 100% that, oh, I have for example a close blood relative who has breast cancer. It means that I'm going to get breast cancer 100%. What it does mean is that you're high risk, and look, then you start to do other preventive behavior that will help you to overcome, or at least mitigate that high risk due to a close family relative, a blood relation having cancer. So that's how you're working this out. And increasingly, as I say, one of the things that is growing more and more is actually looking at the genetic links between cancer. We're finding stronger and stronger genetic links, which of course means that for most people who are laboring under the misapprehension that, oh, my family has no one who has cancer, so I've got no issues, I'm never going to get cancer, that's also false or fake news, simply because we're finding out things about genetic linkages that we didn't know before. And when you look at those links, you're finding that actually you have links. You are at risk for certain types of cancer or different types of cancer due to your genetic heritage. And again, this is something which is unmodifiable. Okay, you can't, become, say, Caucasian or become white overnight. It's not possible, So, however, there are a lot of risks that can be modifiable, and if we went back to that uh, tool that we looked at earlier for ascertaining cancer risk, you look to see some of the more significant modifiable risks are things that are going to cause you to have quite a significant bit of risk. These modifiable risks include things like cigarette smoking and, of course, consumption of alcohol. We've had many different debates about this, and though, okay, there is kind of a bit of evidence which is showing you that moderate use of alcohol may be protective in some cancers, some other non-communicable diseases, such as heart disease. When you look at bigger data onto like never users, people who've never had alcohol before, the evidence still seems to be favoring never ever using alcohol. So, of course, abstinence is the best solution in this case, as in most of others. Obesity is a separate risk, which is modifiable for cancer, and unfortunately, so is physical activity. And here, there's a little kind of caveat or an interesting kind of misconception. A lot of people think that being thin is fine. But what you don't realize is actually that being thin is a separate modifiable risk for cancer compared to obesity. So it could come together. You could be obese and not physically active. But for those who are not obese, not being physically active is a sign of trouble as well. So that's where you need to look at these kind of risks. So a lot of it is things which are very simple. We probably have talked about this multiple times, but it never hurts. As we're looking back and moving forward into a new year, and as we move forward into a new year, I suppose it's a good time to kind of look at kind of maybe putting some new how to say goals into place. We always write our new year resolutions. So one of them this year, try to make them that you will do all of these things that you can to lower or modify your risks to as much as you can lower them to. Of course, quitting smoking, reducing alcohol intake, maintaining a healthy BMI, healthy diet, and a healthy lifestyle. These are things that you can do very, very easily. And I'm going to spend the next few minutes speaking to you about how you can modify these risks. Now, some risks are specific, and screening is one of the things that you can do, which is good preventive behavior and risk, really a form of risk reduction as well. For women, doing a breast self-examination at least monthly is something that is a how to say, not a difficult thing to do. It's a no-brainer. Look, all you need to once a month is to actually perform a breast self-examination. Although there's been quite a lot of how to say education and awareness about this, it's still very, very poor in terms of practice, in terms of people who are actually doing this thing on a regular basis. And so really, if there is one new year resolution in this new year, the new you, okay, should be looking to do this. Do what? At least in terms of self-examination for your breast, try to ensure that you're doing it every month. In terms of your cervical cancer prevention, what you can do is to really get vaccinated for HPV if you haven't already. Now, some people are those who were vaccinated in that cohort of women in Malaysia, and they actually got vaccinated fully. But what we're also finding, because science continues to evolve, yeah, and one of the things that we're getting to know is that when you use those vaccines, we looked at high risk types of HPV strains which could cause cervical cancer, and now we're finding out that in Malaysia there's actually strains of HPV, slightly different strains which may not have the kind of protection from the original HPV vaccine. So for this group of people who maybe had your bivalent or your quadrivalent HPV vaccine, which covers 2 and 4 strains respectively, if I could kind of warrant a suggestion of a gift to buy yourself in the new year, buy yourself a nanovalent vaccine injection for HPV and get that done. And equally, I think it's an equally attractive, very, very life-saving, valuable gift that you could buy a loved one, for example, a wife or a daughter or a niece. That's something which in my eyes is always better than spending money on anything else, because spending money on life. And as with other things, HPV injection is almost affords you lifetime protection. So it's a one-off investment, if you call it such as that. Now, in terms of colorectal cancer, one of the things that we know is that you should look at stopping red meat. Red meat is a big problem maker. and is a major driver of colorectal cancer. And you should kind of limit the intake of red meat to about 350 grams to 500 grams a week. That's not much, okay? And most importantly, we've had this. I think many of us who are working in the cancer landscape have spoken to that about this. That processed meat, okay, your sausages, nuggets, burgers, hot dogs, bacon, ham. These are things which are extremely detrimental to you, and it really drives your risk of colorectal cancer. Colorectal cancer, incidentally, is the number 2 cancer in Malaysia among both men and women. So it's something that really we should look at modifying, lowering your risk, modifying your diet. And eating fish more than 3 times a week has been shown to be really, really helpful as well. Now, in terms of liver cancers, it's not so common, but there's certain protective measures that you can do, which will definitely kind of lower your risk of picking up liver cancer. Among this is, of course, being vaccinated for hepatitis A and B. Always good to kind of ascertain whether your immunity levels are adequate, and if needed, kind of get a booster injection. Ironically, now, what is this? This used to be very difficult to say, but now with COVID-19, everybody understands the vaccines and boosters and all that. So that's really something interesting. So in terms of hepatitis A and B, these are things that you can do to protect yourself against the risk of picking up liver cancer. Similarly, for lung cancer is a very difficult disease to detect early. Almost close to about 90% of all our cases are detected in late stages, and there's very little you can do. So what you can do is, and we suspect, okay, the evidence is not quite out on this yet, that a lot of new cancers in people who've never smoked before is actually driven by secondary smoke. And why I'm saying the evidence is a bit out on this one, we know secondary smoke causes cancer. That is very clear. However, we're not very sure how much causes or drives the mutation within your lungs to actually turn out malignant cells. And this kind of exposure, since we really don't know how much is good or how much is bad, and especially if you're a second-hand smoke recipient who's actually not smoking, I think it's easy for us to really stay away from second-hand smoke as far as you can. If possible, don't get exposed at all. Okay. Now, next is, of course, cancer of the nasopharynx. Nasopharyngeal cancer, or NPC, it's also a big cancer in Malaysia. Quite a lot of people get NPCs, and these can actually be done, or kind of the risk reduction. One of the things that we know we can do is avoid or reduce the amount of salt cured meat that we have, especially your ikan masin, which is for many people a staple in the diet every day. So every other day. So if there's something that you can do to kind of reduce the amount of this intake of salt cured foods as well, please do that. And we also know that taking the HPV vaccine, because now HPV now begins to emerge as one of the causative factors of NPCs as well. And so it's a buy one, free one kind of idea. You get a HPV shot, it kind of protects you against cervical cancer, and as well as now nasopharyngeal cancers. In males, even though it's not too common, it's also a driver of certain male rectal area cancers as well. So that's in terms of what is this, reducing your risks. And now what I want to kind of perhaps highlight and what might be interesting for a lot of us is how to spend your money in order to remain healthy. Now, this is something which is really very, how to say, important, or sometimes even apt for us younger people, because especially in the most of our prime of our life, we spend a lot of our time and kind of days in chasing wealth. But often in your 50s, or nowadays even in your late 40s, you actually start to pick up a lot of problems, health problems, and those are related to things or exposure that happened when you were much, much younger. For example, even for myself, I was a university student who for many years, I think, subsisted on Maggie Mee and Ramly Burger. And now to my utter chagrin, I'm actually finding out that, oh dear, I should not have had that much of processed meat. So despite going to like almost, non-existent amounts of processed meat in my diet, today we're still kind of having to deal with the repercussions of all that much of intake for years and years previously. So for the average Malaysian today, okay, when we talk about staying healthy, you often run up against this problem of being healthy or doing things in a healthy manner is actually expensive. So we often get faced with this, and they're like, Doc, it's too expensive for me to eat healthy, or it's too expensive for me to do XXY. So I'm here, perhaps in the next couple of minutes, to kind of put to you this idea or this hypothesis of how to spend your wealth in order for you to remain healthy. Now, that is, I think, quite a important fee of thing to do. Now, how do I kind of look at this? I always look at the cost uh, against the kind of benefit, and ultimately the cost of cancer or treating cancer continues to rise. This is an old slide. I think it looked at things in 2013, and we're 1 year away. In 2022, we'll be 1 year away from 2023. And look, the costs, I think, if anything, have risen beyond the cost that was predicted when this actual financial modeling exercise was carried out. Okay, in 2013, these were the kind of costs that they look at in terms of treating cancer. And in 2023, you can see those numbers have grown, ballooned, sometimes at least increased 3 times more. So the problem is with most of us, we are about 10 or 15 years away, in many cases, of being at risk for cancer. If you're someone who's young, in your 20s, you're looking at an increased cancer risk in your 40s. Okay. And at that time, 20 years from now, can you imagine, if you put inflation into it, how much is it going to cost to treat this disease? So always at the back of your mind, think of the cost savings if you can avoid cancer. I mean, if I was to put it brutally like that. So don't get cancer and save a lot of money, So that's really what you need to do. And what is more important is, and very significant, is that a lot of the investment or the savings that you get from cancer is exactly the same kind of savings that you're going to get by investing in, say, healthy eating, physical activity, nutrition, because they also are going to help you reduce the risk for heart disease, stroke, diabetes, and kidney disease. And so it's really a case of invest in one and get four for free. Buy one, free four, lah, as we always kind of see ads on this. So as you can see, the numbers in terms of cancer just sky high. And look, one of the first things that a lot of people kind of have in terms of risk reduction is actually not considering whether you have insurance or not. So if you're a young person who's coming out to work, or even if you're in your 30s and you're looking at revisiting insurance, okay, I think rather than invest in, say, changing your iPhone, or any other expensive telephone accessory for that matter, every maybe 2 years, I think you should look at very seriously the idea of improving or if you haven't already had insurance plans, to actually put into place insurance plans, because at these costs, and now I think, and this is slightly older figures, I think even now the premiums have come slightly down. Okay, they've become lower due to competition and such like, and you get a lot more how to say wider, more comprehensive plans. But on average, you're looking at spending maybe 200 over ringgit a month for an annual premium, for example. Okay, these were which were numbers which were picked out in 2020, and it gave you that kind of more or less these figures in terms of a very generic insurance plan. Don't worry, how to say, I don't work for any insurance company, don't get any money from any insurance company. You can buy whatever type of insurance you like. But 2 points of note: for those who have only health employer coverage, or employer driven health insurance coverage, please, please, please be very, very careful, okay, and cognizant of the fact that it's not always that you're going to keep a job for 30 years, 40 years, or very easily move from one job to another. There may be significant gaps in your health insurance coverage if and when, for example, if you move from one job to the other, or even worse, a lot of people now start up businesses, and when they start up businesses, they don't realize that one of the kind of things that they forget to do is actually start up their own health insurance, because they've been dependent on employer insurance for so long. Employer insurance coverage is good. I'm not saying it's bad, but it's just often not enough. Okay, first point. Second is, employer health insurance coverage will only last for as long as you're employed. And let's say you're employed till the age of about 55 or 60, or now even we're talking about 65 years old. Beyond that, what do you do? Because at that time, your health insurance coverage goes away. And that unfortunately is the time when you start falling sick. So one of the big investments, I come back to this term of spending your wealth, one of the big investments that you need to make in terms of spending your wealth in order to remain healthy is really to have good, solid insurance plans. The earlier you take them, okay, the less you will end up paying in terms of premiums. And some of these plans now have limited time of paying, meaning you pay for 20 years and after you don't need to pay them anymore for life. So it's really, really an important investment for you to make increasingly, because I go back to this slide and speak to you about the problems pertaining to cost. We find, as I was telling you much earlier in this session, more than 60% actually of all our cancers are diagnosed late. And now we're discovering better and better medication to treat those cancers even when they're discovered late. Okay, in many cases, it's revolutionary things like immunotherapies, targeted therapies. They're making cancer into diabetes, where, okay, for the person even diagnosed in late stage cancer, they put on this drug and they can live for years. So it's just a matter, and have good productive lives at that. So it's about just putting on these drugs, but unfortunately they're expensive. And when you do not have health insurance that's able to cope with paying for these therapies, they become inaccessible to you. And at that point, it'll be too late for us to kind of sit and cry at why didn't I get these medications? It becomes a difficult thing. Now, as I was saying, if you kind of average it out, it's about 250 ringgit a month for the cost of your life. Now, again, am I telling you to take an annual limit of 2 million, 3 million? This is just an kind of estimation. At these high annual limits, these are the costs of your annual premiums. So should you take something lower? Why not? By all means, do something which is within your means, but however, keeping in mind, make sure that you take a policy that is able to kind of, in 2023, picking up breast cancer is going to cost you about R1 million, it looks like, from the modeling. So then suddenly these annual limits of 1 point something million don't look so distant after all. So that's you need to keep that into perspective. The treatment continues to grow more and more expensive, and the fact that having a very small policy with like a low kind of ceiling earlier on in your life, and you're paying very little, but you also kind of have a very low ceiling that might not be beneficial in the long run, about 20 or 30 years, when you actually do end up getting sick, and prices have become super expensive. Now, so next is, of course, healthy eating. And again, this is a very different perspective from what always nutritionists and dietitians kind of talk to you about, because they're talking about calories. I'm talking about the dollars and the cents. So, for example, we talk about things like red meat, and red meat is, I think, local bone in metal. Again, I don't think these numbers are accurate. I remember at Deepavali this year, 2021, I think we were looking at the upwards of about 60 ringgit per kilogram of mutton. That's how expensive these things have now become. Or even imported lamb, they were looking at about 25, 30 ringgit a kilo. And even beef, looking at about 15 odd ringgit. Even that, I've been told now, is much higher per kilo in terms of costs. And our recommendation is, as you can see, the recommendation from the World Cancer Research Fund is actually to reduce red meat, to consume less than 500 grams a week. 500 grams a week is not much. And this is where this whole idea of is superimposed on the kind of consumption of Western food, or a lot of processed fast food. Because, for example, now with some of your fast food burgers, you get a double patty, you get a triple patty. Some of I remember for a while there was this craze about burger bakar, where you could have 6 patties, 7 patties, just in one sitting. You could consume more than 1 week's amount of red meat. And it's the same, of course, with things like, I know now there's all these like tomahawk steaks and so on, which are like kilos and kilos in weight at one sitting. So you can imagine, okay, both in terms of how much money you would save by cutting down significantly on red meat, as well as how much of risk you would reduce by not really engaging onto red meat. On the other hand, for example, and remember I told you that one of the recommendations about fish is to eat fish more than 3 times a week. And eating fish more than 3 times a week actually lowers your risk of picking up cancer, amazingly enough. Now, how much does your fish cost? And again, one of the things or the myths that has been propagated about cancer or any other kind of disease prevention is, oh, you need to get very atas kind of food or atas kind of fish, looking at like, say, salmon at about 40 ringgit per kilo, but you can get things like tilapia. This is, of course, these slides were made before this past 2 weeks sudden increase or the crazy hike in terms of prices. Yeah, so these prices are not really reflective of current times, but it's just to kind of illustrate that all fish actually, even if you ate ikan bunus or ikan kembung or ikan what is this, the most basic fish that you can find, it is still giving you the same amount of risk reduction, same amount of nutrients. So if you're going to eat salmon, the short of the word is, if you're going to eat salmon, you do not need to do it because you think it's going to keep you healthy and reduce your risk of cancer. Any fish would do as fine. If you want to eat salmon because you want to eat salmon, by all means, that should be a choice. But it's not a necessity for you to eat salmon or any other kind of super expensive fish under the thought that, oh, this is going to actually reduce my risk of getting cancer. Now, again, how about vegetables? Oh, another very sensitive topic in Malaysia today. Even when I went to the market last week, I was getting a heart attack from looking at the price of vegetables. Looking only, not even eating. So looking at the price of vegetables might actually increase your risk of getting cardiovascular disease today in Malaysia. Different story. But however, generally, vegetables are much cheaper. And we do know that having adequate amounts of vegetables a day, okay, non-starchy vegetables, is really going to be helpful at reducing your risk of cancer. And similarly, sorry, I'm just going to go back a little bit because here there's another misapprehension we really need to correct. There's this big idea that, expensive imported vegetables, kale, I don't know now, all these kind of organic, expensive imported vegetables from the jungles of Brazil or such like, now often they are touted or they advertised as being, very beneficial. They are the only ones that are effective to reduce your risk of cancer and such like. It's all just utter lies. Okay, any vegetable, even the humble tauge, has as much benefit as any other vegetable. So in terms of vegetables, the non-starchy vegetables, you're going to get an equal amount of benefit, whether you get eat kale, which is about horrendously expensive, especially imported organic kale or whatever, as compared to maybe pak choy or Thailand or bayam or whatever. So that is where this is. In terms of nutrients, they're all similar. So if you want to spend your money on kale, fine, but it needs to be something you're doing out of choice, meaning you want to really eat kale, by all means, go ahead. But don't do it because you think that kale is going to give you those additional health benefits. Save your money. Spend wisely. Okay. Similarly, in terms of fruits, your watermelon and your pisang gives you as much nutrients and benefits as all your other imported acai berries and so on and so forth. Did the same. Okay. Now, WCRF recommendations are to actually put up about 2 servings of fruits and vegetables a day. Next, and so that's where you can spend wisely in order for you to kind of get health by spending just a little bit of wealth. And actually, I'm actually making the case that hey, you'll even save money while you're at it. Exercise. Is it expensive to exercise? Again, you really need to kind of thank the YouTube season because now you get so many videos of different people showing you how to do exercises online, and most of this can be done in a home setting without the use of any equipment, equally beneficial. Look, I'm not saying don't need to pay to go to a gym. By all means, this is an investment worth making. But for those who are complaining that mahal lah mau pergi gym ke apa ke, there's so many other alternatives were equally efficacious and most importantly, almost at no cost. So now we come to the next kind of major kind of concern or complaint, or you need the excuse, which even sometimes I give most often than not. It is that of opportunity cost. We always say that we have no time to do this. I have no time to exercise. I have no time to spend on doing these things which can reduce my risk. And this is, again, a very kind of mean salary of doctors, accountants, engineers, and you can work out your salary per hour. Now, what you do know, okay, is that we know that we need to exercise only about 45 minutes, 30 to 45 minutes a day. So the question will now be, is this 62 ringgit 50 cent 33 ringgit that you now we're saying that this is the cost, the opportunity cost that we lose, or by not spending that hour on exercise, or all these other things that I can do to reduce my risk. Okay, this is the expense that I'm going to kind of save, the money that I'm saving. But is this worth it, or is it even going to be enough when compared to the cost of treating a cancer even when it pops up? That is the question you need to ask yourselves. Next thing, of course, and I think this is another thing that we've talked to death, is quit smoking. Okay, enough said. Smoking just gets more and more expensive, and now, of course, it's more atas. A cousin, vaping is also equally an expensive habit. And yes, vaping has its own risk factors for cancers. We're seeing more and more of it pop up over time. So it's really time to look at that very aggressively. If you're switched from smoking to vaping, please consider quitting. If you haven't started, please don't start, just quit. Alcohol consumption, again, is this an expenditure of wealth which is necessary? Okay, and so we're looking at costs which you can save, and those are costs that you can put into risk reducing behaviors, which will be really, really healthy and significantly impactful in your lives in the long run. Of course, some of us, especially during festivals, we spend a whole lot of money on alcohol, and most importantly, we consume a whole lot of alcohol. A lot of us consume alcohol on a regular basis, and again, this is expenditure, this is money. These are things that we can look at reducing, if not significantly stopping altogether. Now, another thing that you can look at is, which I think is things like preventive health behavior, such as screening. We talked about screening earlier, and that's also a good investment, especially for those who are above 30, 35, 40, 40 above. I think really it's warranted to do a yearly annual screen. Again, we always get this kind of complaints from people when they spend money on a screening, health screening, and after they go to a health screening, they come back and tell you, look, nothing lah, no result. When there's no result, no positive result, it's actually really good news, but they're sad because now they spent the money and then, there's nothing to show for it. What unfortunately happens is next year, they feel that because of this, they actually don't want to get their health screened again. Yeah, waste money lah. I'm going to get a normal result only. So this really is a worthy investment to make. Okay, and it's good because now under your tax bracket, you also get an income tax deduction for going for a health screening. So that's an incentive that the government provides as well. So with that, really, I am coming to almost the end of this session. And as much as we, like to speak about risk reduction, what's also important in risk reduction is sustained efforts. You can't go and climb Mount Kinabalu one day, okay, and then for the rest of the year, you do nothing except play PS in the house, okay? One of the important things about risk reduction is the fact that it needs to be done constantly and consistently. So my message for you would be to, one, start slow, okay? Don't be over ambitious, but at the same time, you need to have some sort of ambition. Cannot be where, our daily requirement for steps is 10,000 steps, for example, and you start off slow, because there's always the two extremes as we come onto the new year and we talk about going into the new me. Some people will start and straight away, okay, I will walk 100,000 steps. They will do it for 1 day, 2 day, third day. By the third day, all their knees are worn out. They'll be crying. And then by the fourth day, fifth day, they stop doing it. And that's the end of their exercise resolution for 2022. Okay. Similarly, some people will go on all these miraculous diets. Won't need anything except breathe sunshine. Last about 3 days. And then the fourth day away, there they go binging on like 3 roti canai or 4 roti canai all at one go. So my advice as you go into 2022 is start slow. With all your health preventive activities, you're going to start running, you're going to start exercising, you're going to start eating healthy. These are things that you should do gradually, okay? But at the same time, gradually doesn't mean, okay, I will walk 1,000 steps alone for the next 2 years. Every day I only walk 1,000. So after about 1 or 2 weeks, switch it up a little bit, increase it from 1,000, go to 1,005, go to 2,000, reach that 10,000 steps in a manner that you're comfortable with. I'm just using the steps as an example, but it applies to physical activity, it applies to eating healthy, everything. And these are things that you should be doing consistently and constantly. Only by doing this thing in this manner, these things in this manner, will we be able to reduce our risk of picking up cancer in terms of modifiable risks. Because remember, your non-modifiable risks are risks that you cannot change at all. But your modifiable risks are things that we can change, and we can use that to kind of mitigate and reduce our risk of getting, of ever picking up cancer. So as we end the new year and we go on to the next year, as we end the old year and we go on to the new year, it's time to look back and see what is it that we have, could have done better, okay, over the year perhaps. And in the new year, let's look towards building a new me. And a new you means a new you that has a much lower risk of kind of risk factors for you to actually pick up cancer. What you can do is, coming back to that little risk calculator that we had a lot earlier, okay, that you put up at the beginning and I put up at the beginning of this session, that risk calculator you can run yourself as frequently as possible. And every time you can see how much you're improving your risk factors. Okay, and as you begin to act on those modifiable risk factors, you will find that not only do you get much healthier, you're actually mitigating a lot of your risks for not only cancer, but almost every other non-communicable disease. With this, we are going to end this 2021 series of Cancer and I, and we hope that it's been really beneficial for all of you all, especially during this pandemic, and a lot of people have been at home. We hope this has been helpful, insightful, and as we come on in 2022, expect a new us as much as we expect a new you. So wishing you all a very Merry Christmas and a Happy New Year. And we'll see you in 2022 with our next kind of installments of Cancer and I. And with that, very good night and see you soon.